Hey everybody, my name is Jennifer Huff. I'm an occupational therapist, and this is me. I am going to talk to you guys today about aging in place and what an occupational therapist does. How can it benefit you and those in the community? My business is Your Aging Therapist. I just started this business last year, but I serve, like Robin, I go to homes or places that you live, anywhere that you live. Can y'all hear me in the back?
Yes.
Okay. All right. And I can perform any occupational therapy service, which I'll explain in more detail. And I do take insurance, so I bill your Medicare Part B or supplemental policies as well, so we can do insurance verification. So, you go to the next slide. So, like I said about me, I'm an occupational therapist for the last 16 years. Most of my experience is with seniors. I've worked in skilled nursing facilities up until this past year when I started my own practice, and still working primarily with seniors. And went to MCG, and I have some certifications that are beneficial with aging in place. So I'm a certified aging in place specialist, and also with LSVT Big is a Parkinson's treatment that is a program you can get involved with for Parkinson's. So what does occupational therapy do? You think of us as a functional therapist, and by functional, it really just means, how you perform a task. So things that may be difficult, anything, reaching items in a cabinet in the kitchen, being able to get through your bathroom with a walker if you have to use a walker, getting in and out of bed, just any task that you do on a daily basis that's part of your daily life. We assess that. We can break down, if you're having issues with it, where is the breakdown in that task, and how can we talk through it or problem solve it and provide recommendations that will make that task easy and keep you as independent as possible. So OT really, that's where OT really shines in the home setting when you're living at home, because that's your domain, and that's what we're going to focus on, is keeping you there. In places like assisted living or skilled nursing, things like that, we also go in there. There's just a bigger care plan team approach. So you have the nursing staff, you have CNAs, you have maybe personal sitters, things like that. So we can also collaborate, and then also other therapies. OT, I personally love to collaborate with physical therapy for the treatment for patients as well. So because we look at the person differently in what we're working on. So overall, it's really beneficial to collaborate. So we, like I said, we can go anywhere. It just changes the process of how we're able to help you and keep you. The main thing is keeping you independent. Physical therapists, like I said, we look at things a little differently. Physical therapists are going to focus a lot on helping injured people, recent illness or injury, to be able to improve your movement and manage pain. So they're a very important part of preventative care, and then the rehab process, and treating with a lot of physical methods versus just going straight to medicine or surgery. So
right.
I'm going to get to the next slide. So just to give a few more examples of how specifically OT can help. As I said, we're functional therapists. With working with the senior population, I do focus a lot on fall prevention, because that is always an issue. I'm going to go into a little more detail on the statistics. But we assess, why have you fallen, or is there a fall risk? We teach adaptive and safer ways to perform any of your daily activities. Adaptations for vision loss, low vision, glaucoma, things like that. How can we adapt your environment? making any energy saving techniques, like teaching that for if you have COPD or heart failure, things like that that cause you to fatigue really easily. We can teach you the easiest way to perform a task so you don't exert so much energy and you don't wear yourself out, just getting dressed in the morning. Also, one thing that's very beneficial is in your home or environment, making any equipment recommendations. So sometimes it's as simple as just recommending a tub bench or something that eliminates stepping over to get in and out of a shower. Something like that runs about $50 or $60 versus pulling everything out of your bathroom and then redoing it. So just simple things like that. Sometimes it's a matter of elastic shoelaces and a grabber and to be able to do your socks and shoes, things like that. So and then with patients with cognitive deficits, a lot of times we assess safety in that situation based on what they typically were doing before dementia is setting in and things like that. So we'll still focus on that, but then also doing a lot of caregiver training and just learning, everybody's different and what is the individualized approach, what is their best approach to, for daily living. So moving on to some aging facts. The CDC has reported there are 36 million seniors that fall each year, with about 32,000 deaths occurring. 55% of those falls occur in the home, with women they're about 50% more of an increase, especially if they'll fall more in the home, whereas the men tend to fall working out in the yard or the garden or something like that. By the year 2030, all the baby boomers will be 65 and up. So in that, we know that the aging population as a whole, there's so much more that's going to come with that. So caregiver needs are going to increase, just physical needs and all that will increase. So with the cost of living in facilities and healthcare payment models, Medicare changes every year with what they will pay and everything. So the cost of living in a facility right now, a skilled nursing facility, is about $9,000 a month plus supplies, sometimes plus medicines. Once you reach that private pay status and your Medicare is no longer, your insurance isn't paying. So to me, it's like, I really strive to, how can we best use the money, because nobody wants to have to go live there or live in a facility. So I want to be able to help keep people in their home safely to avoid that. So that brings us over to the aging in place topic. So aging in place just means that we're going to stay in our home as we age, but with our needs changing, we need to figure out how we're going to adapt or compensate to productively age. So how we're going to plan ahead. If you're a planner, you may have already thought of some things, but if not, this is a time where you might want to consider what are some safety risks that I might have at my house, or what can I do, because I don't want to wait until I've been hospitalized for 2 weeks for something, and then I'm coming home and, I can barely move, and now I'm needing all these adaptations, and things take time, right? So occupational therapists I've done a lot of home safety assessments working in skilled nursing. When we're getting ready to discharge a patient home, we will go out to the house and do a run through with the family and make recommendations. So just being able to have that eye for potential hazards, and maybe just you have your furniture in a certain place and you never move it. There may be things that we can suggest that to make things a little bit more accessible that you hadn't thought of. So not that you are not trying to not be unsafe, but So in your binder, there is a couple of handouts that are really great. The CDC has a program called STEADI, STEADI, and it is for stopping elderly accidents, deaths, and injuries. And so with that, it talks about 4 ways that you can prevent falls. And also a handout about just a little checklist. You can go room to room in your house and look for potential hazards. So if you have stairs with a rail, is the rail sturdy or is it wobbling? Do you have some wood steps that maybe are slippery or loose boards? How is your flooring? Do you have tile or carpet? Are there rips, tears? You know, just taking that critical eye, that checklist is really good to kind of guide you in your thought process. So that would be a good thing to go through and do. So if you do find that there are some potential needs there, that is where, you know, we can come in and make these recommendations to prevent falls. So like I said before, with flooring and entering the bathroom we know can be a very dangerous place. So let's not have the throw rugs, nothing that is not like a rubber, installing grab bars. If you have the tub shower combo, you could have the bench that goes across the tub, and there's 2 legs that come right at the outside of the tub, so you don't have to have a lot of extra space, but it enables you to come up to it, you completely sit down, and then you swing your legs over. So it just eliminates that fall risk of stepping over, losing your balance, and never depending on a glass door handle or towel bar or something like that. One of the biggest and easiest things that you could check at your house is the lighting. Okay. So, and I have a slide, the next slide. These are all things that I have personally ordered and or used with people, and they're all $20 or less on Amazon. And the thing that I like about these 2, the one on the left here is a motion sensor bed light, and it comes as like a little strip, and you just, it's not going to mess anything up on your bed, but it's an adhesive little strip that you put along the bottom of the bed. But as soon as you go to swing your legs over to get up in the middle of the night to use the bathroom, it's going to illuminate that whole area. So, you know, it creates a night light. If you're somebody who has to have it completely dark, you know, it's not going to bug you all night. But if you go to get up, it'll light up. So that one I really love, and it will stay on. You can set it for like 20 to 30 seconds at a time, and it'll go off, and then it'll come back on as needed. So that's what that one is. The same concept goes for this commode. These right here, it just hangs off the side. So as you enter the room, I think it has an 8 or 9 foot detection. So as you're entering it, it's going to illuminate that area as well. So if you've already reduced clutter in the areas that you walk, then that you'll safely get in there. Okay. At the bottom is, it's a roll of non-slip tape, and I like it in the roll you can get off Amazon versus the ones that you can go buy the already cut strips at Lowe's or Home Depot, because you can get this in different colors, which if you do have low vision, the color yellow works well, or like an orange or red. So it creates like a contrast. So if you do have steps or something, you can add the tread, but then also add the contrast. So that just takes down your fall risk on stairs and things like that. So yeah, so ways to prevent falls. And does anybody have any questions about home accessibility and things? Yes, ma'am?
You need a referral from your PCT in order to have your company come in or you come in?
So, it is best practice to have a referral because of the doctor just having that relationship. But I don't have to have a referral. I just have to be able to follow up with the primary care physician to sign off on the plan of care. So, usually it's not an issue, but yeah, if you're already seeing your primary care physician, which actually is one of the recommendations I have for keeping up with those appointments yearly, you could go ahead and say, you're your best advocate. I think I could use some therapy or, want an evaluation. All they have to do is just write OT to evaluate and treat. So OT or PT.
And who is your pay source? I mean, who pays you?
I get paid by Medicare. So like I said, I bill Medicare and the supplemental insurance. So that's how I get paid.
Okay.
Mm-hmm. So, talking about going to visit the doctor, keeping up with those appointments is really important because things like the medicines you take that may change. If you've had an illness or hospitalization, 9 times out of 10, your medicines have gotten changed around a little bit.
Yeah.
So we need to reconcile that. We need to keep a folder that has things listed out. I recently did this with one of my patients in assisted living. She manages her own medicines, but we went through, wrote everything down. She went to her doctor, took her folder, and I feel like he appreciated that. He wrote some notes and then added one, so he wrote that in, and it's just like a way to, take ownership in what you're on and understanding it as well. So some medicines like antidepressants, antipsychotics, and blood pressure medicines, all of those can pose a fall risk. So just understanding why you're on it and making sure that that's still something that's needed. So with the medicines. Also, with keeping up with medicines, also having a list of who is your care team. If you're living at home, like who are your neighbors, who are your friends, what is your hospital preference? Also, your medicines are right there as well. Like having all that, within reach if something happens and you can't speak for yourself at the time is really an important way.
Okay.
Keeping up with exercise, we've spent a lot of time talking about that, and joining the Y. There's really easy, accessible ways to keep up with some sort of exercise program or walking program with a friend. Joining senior groups. And as far as the home, if you did need some sort of heavy-duty renovation, if just a piece of equipment is not enough and you need some structural things, it's really important to collaborate with someone in the therapy world or somebody who deals with accessibility, because disabilities being considered in a design plan is so important, because a universal design is a term that I think is a little bit more adopted, but you still see some of these new construction homes that maybe aren't, suitable for everything. But universal just really means that people of all stages, somebody who doesn't have a disability, all the way to someone who's an amputee in a wheelchair, could still, access stuff. There are, cabinets that can roll out from underneath a sink so that you can come in. There's tilted mirrors. So, you can still see yourself in the mirror when you're brushing your teeth, if you're having to be in a wheelchair, things like that. And so we can connect you with some, contractors or people who are more mindful of those types of things. Other tips, of course, having like the electronic, like the Lifeline or something like that is really good. So one thing a lot of people don't think of is the Alexa, which is something that is used for so many things. It's around maybe $50, but you can it can call people that you have like in your cell phone. You can call from it if for some reason you didn't have your phone where you could reach it and you fell. She can call 911. She can set reminders. So one of my patients, her family programmed every day at 10 to remind her to drink water.
Okay.
So it's just that's just a cheap, easy fix. So.
And if you're out and about, Alexa will actually still remind you on your phone too, because you can set up an app. So if you're not home when your reminders usually go off, and it's like, hey, I know you're not home, but you need to drink some water. You're like, okay, got it. I need to drink some water. So that's also a really cool feature of it.
Yeah, it is.
Exactly. So I think I've covered all the, all the tips that I could think of off the top of my head. But like I said, I did forget one thing. Lighting. When I was talking about lighting, I'm all about cheap, easy things, right? So I actually found this at the Dollar Tree 2 days ago.
I saw them for
And it's $1.25, but
$1.25.
Yeah.
this literally took 3 AAA batteries, and you could just put like a little push pin in the wall somewhere. It's not going to mess anything up. It's easy to change the batteries in and out, and it just gives you like an instant night light. And it's not like you're going to leave it on constantly, so I feel like it's going to last you. For $1. I mean, you can't beat that.
I got about 5 of them around the house for my mom.
Right. So perfect. I mean, this is just so, and if you have a loved one that's in a facility and they need a little extra lighting around the bed, I mean, pick these up and give them to them as well. So I just want to thank y'all for letting me give you some tips. And my contact information is in the my brochure as well. So it's
The fall thing.
the fall
Like
the
Yeah,
notes.
Yeah, where you could write notes on it. It's like
So-
at the very back.
Okay.
Yeah, if y'all have any questions, you can reach out, or if you need an assessment, I'll do that for you. So thank you.